Good day, dear friends. With you is Natalia on the Dr. Savkina channel. The slightest disruption in the kidneys leads to serious malfunctions in our body. What diseases are capable of causing pain in the kidney area? How to recognize them in time and what to do about it? We will talk about this with you today. It should be noted that most kidney diseases progress without symptoms. So, in what cases should you sound the alarm and seek help from a specialist? Firstly, when foam appears in the urine, which indicates the presence of harmful substances and primarily protein. In other words, the filtration capacity of the kidneys is impaired. Secondly, the color of the urine can change. A red or brown tint indicates the possibility of blood in the urine. Special attention is paid to pain in the lower back, lower abdomen, or under the ribs, lower abdomen, or under the ribs. This pain can be confused with symptoms of other diseases, such as appendicitis, acute cholecystitis, inguinal hernia, and even exacerbation of osteochondrosis. How to understand that the pain in the lower back is specifically related to kidney problems? When back pain appears, you need to ask yourself two important questions. The first question, what preceded the appearance of pain? Any infection or general overcooling of the body? If there was a general overcooling of the body, then pyelonephritis and inflammatory kidney disease should be suspected. With local cooling, especially in combination with excessive physical stress, the most likely cause of pain is the exacerbation of osteochondrosis. And the second question, was there any tonsillitis 2 weeks before the pain in the lower back appeared? In that case, if you had tonsillitis 2 weeks before the pain in the lower back appeared and the treatment was conducted without the use of antibiotics, you should consider the possibility of developing glomerulonephritis, a more serious condition than pyelonephritis disease. To clarify the nature of this or that kidney disease, you need to take a general blood test, a general urine test, and undergo an ultrasound examination of the kidneys. By the way, if the pain in the lower back is specifically related to kidney pathology, there may also be frequent urges to urinate, swelling of the legs and face, monotonous headaches, nausea and vomiting, increased temperature, and jumps in arterial pressure. So, what to do at home, being left alone with intense pain in the lower back area? In other words, with renal colic, medical assistance in this case should be competent and timely. In this case, the sequence of actions you take is important. First of all, you need to call an ambulance and try to figure out the nature of the pain yourself, which is what one was talking about today. Monitor changes in body temperature and collect urine as possible. Pain in the kidney area can be relieved at home using warming compresses or a heating pad placed under the lower back. In this case, do not forget that the duration of the heat effect on the lower back should not exceed 20 minutes. In the absence of high temperature, you can take a hot bath or shower. The most popular remedy that should always be present in the home medicine cabinet is no-shpa, in other words, drotaverine. It can be taken not only for renal colic, but also to relieve pain of any other location. This drug reduces muscle spasms. At the same time, you need to take 2 tablets, and it is best to make an injection intramuscularly if possible. Before arrival, it is strictly forbidden to relieve pain with analgesics. I want to emphasize this for your attention. This medication obscures the symptoms of the disease, so it will be quite difficult for the arriving doctor to determine the cause of your discomfort. In other words, it greatly complicates the diagnosis of the disease. It's very important to maintain a sufficient drinking regime. However, the well-known formula of 30 to 40 milliliters of water per kilogram of body weight does not suit everyone. In case of kidney insufficiency, it is necessary to limit the intake of drinking water to 1.5 liters, and in some cases, even to 1 liter per day. And in case of urinary and excretory disorders, it is absolutely necessary to limit fluid intake. In what cases is it absolutely impossible to refuse the hospitalization offered to you? Firstly, if the pain does not go away after you have taken certain medications. Secondly, if your well-being deteriorates and vomiting appears. Thirdly, if there is no urge to urinate and the urination process itself is disrupted, and in case of the presence of a single functioning kidney. Among the methods of traditional medicine which can significantly alleviate pain are infusions of chamomile, yarrow, and goldenrod. 1 teaspoon of the mixture is brewed with a glass of boiling water and taken as needed 1 teaspoon every 2 hours. A decoction of birch leaves and buds is quite an effective remedy. It should be taken as needed in a hot form, consuming the decoction over the course of an hour. It excellently dilates the ducts, facilitates the excretion of small stones and the decoction of oats applied to the kidney area. In pharmacies, you can buy many different preparations based on plant material, which are quite effective for treating kidney pathology at home. I'm referring to cystone, phytolysine, and cysteinol. They all work quite well and are successfully used for treating kidney problems at home. One also recommends you watch the video 7 Signs of Kidney Problems. Stay healthy, dear friends, and until we meet again.